fibroids can be associated with infertility, but a lot of women get pregnant with fibroids, like the example I gave you last week. So, but another stigma in Jamaica is that once you have fibroids, you're infertile.
Right.
But it depends on the location of the fibroid.
Yeah. Welcome to the Honi Pot Show. I'm your host, the Stinger Honi B, and today I'm delighted to have on the show Dr. Daryl Daley, OBGYN, an obstetrician and gynecologist whose singular aim is to offer international standard of care to all women whilst maintaining professionalism, communication, compassion, and empathy. Ladies, he's the man you need. Welcome, Doug.
Thank you for having me.
Wonderful. How are you today?
I'm good. I'm great.
Excellent. Excellent. Now, before we get into the meat of anything, we share drinks.
Of course.
Yes. So, I remember you telling me Long Island
100%,
iced tea is your drink. So, I had to go hunting. Yeah. And I got it for us. So I'm going to share it with you.
Thank you.
There you go. All right, lovely. You can use a straw. I got these nice metallic straws.
I can not use a straw?
No, certainly. Because we don't want to, you're between seven. I want to not take a straw or not, but we just say, offer it. Cheers.
Cheers, my man.
In
This
case.
This is
Yeah?
good. This is good.
I got it at Macau.
Yeah, man, this is good.
Yeah.
Strong.
Yeah. Solid. Ooh, yeah. Come and say, we're just going to do one.
Yeah, man.
One's enough, but we got some water here as well.
Yeah, man. Yeah, man. That's fine.
In between and so. All right. So, I want to start with basically asking you, what inspired you to dive into the field of women's reproductive health?
It was kind of straightforward and easy. My dad is a established OBGYN. My mom is a pediatrician. So I actually was born in medicine.
Yes,
literally,
indeed.
that's all I knew growing up. So growing up, the time I spent with my dad was following him to the hospital, watching him deliver babies, watching him do surgeries, just being right by his side. And I saw how happy the field made him. If you know my dad, he always has a smile on his face, always laughing, and he loves taking care of women. And I always said, if this makes him that happy, I want a piece of it. So there was no pressure, there was no forcing. It was something that I just naturally went to. It was just a natural process. From I was 4 or 5, I said I just want to be like daddy. I want to be a gynecologist. I want to be like daddy. So medicine was the only option I had. There was no other option that I entertained at all. Nothing at all.
That's amazing. It's just straightforward. This is what I want.
It's easy. It was a no-brainer. My brother is a doctor. He's a general practitioner. My sister-in-law, she's a gynecologist as well.
Wow.
So it's a one happy, tight family filled with doctors.
Yeah.
So you want to see that table conversation.
What I admire about you is your passion for your craft. I think that's so very important. Whatever field you're in, to have some passion. Because once you have that, I think that you will give it your all.
100%.
You will excel at it. And it's pretty good.
I'm very passionate about it. Women are easy to talk to.
Yeah?
They're easy to communicate.
Can you say that again?
I'm talking a professional point of view right now. When women come to me for help, whether in the private or public sector, I find they're very easy to communicate with, and it's easy to get to the problem. Just talking to them and asking certain questions and being, empathetic, compassionate. All of that helps as well. Personable, and I find that they just the conversation flows. Once they're coming to you for a problem, and you are there to try and help them, I find the process goes so much easier. So it's quite delightful.
All right. All right, so today you're here to help me to spread awareness on fibroids. So we have to start at the very basic. What are fibroids, and pretty much why are they so common amongst Black women? All
right, so fibroids are non-cancerous growth of the muscle or the uterus or the womb. Very, very, very common. Unfortunately, we're not too sure what the causative factor is. It's multifactorial,
Yeah.
right? We know ethnicity is one. You mentioned black women. It's very common in black women. There's a strong familial link as well. Like if your mom had it, you're more likely to have it. There's a dietary link as well, you know. They're saying that red meat can be linked to fibroids as well. And it's just multifaceted. We can't put a finger. It's not like cancer of the cervix where we can say 99.9% of them are caused by the HPV virus. We're not too sure. And it's just a non-benign growth, a benign growth, sorry, of the uterus that can really significantly impact a woman's quality of life. That's what I always tell women. If this thing is disturbing your quality of life, not allowing you to function properly, not allowing you to live a normal life, you know, it causes heavy, painful, prolonged periods. I'm sure we're going to get into that.
Yes, indeed.
And it can just make a woman's life miserable. And contrary to popular belief, we're brought up in a society to believe that all periods are supposed to be painful. And that's the furthest from the truth. You know, so my aim is to help to educate women and to provide some kind of intervention to help them have a normal quality of life. That's what we're trying to achieve when a woman is symptomatic of her fibroids.
And it's such a very important point that you raised there, that in our society we tend to believe that painful periods are normal, because I believe that for such a very long period of my life. And so before we dive deeper, I want to share a bit of my story, my journey with fibroids. You're the doctor I trusted with my myomectomy.
Thank you for trusting
Of course, and I'm happy I did. 10 weeks. This is 10 weeks
10
later.
weeks.
Okay.
You don't look like she had surgery.
But I want to start from the beginning, that because when I remember when I started my periods, I was 14, and from the jump they were heavy. And eventually got more and more painful as I grew older in high school. And I remember to the point where I used to have to go home, you know, and at that time, no one's checking in to say, wait, maybe this is not normal, maybe I should take it to a gynecologist, maybe I should check that out. And so you grow up with that. And then I remember years later, when I moved to Japan 4 years ago, interestingly, I don't know if I told you this, but it changed my cycle.
Yeah, you did. You did tell me.
Yeah, I bled less. It was less painful. But as I was telling you at the time, I was drinking a lot of green tea every single day.
We're going to talk about green tea as well. Yeah.
And I was eating less meat because they consume strips, very thin strips of meat.
You can see their body appetites, they're all slim.
Yes, exactly. And I remember when I went to gynecologist, that's when I found one. She said it was 3 centimeters at the time. And I remember thinking, oh my gosh, okay. And she was like, yeah, try to have children before 40, blah, blah, blah. So when I moved back to Jamaica, I kid you not, when I landed in America, I think it was my second period. It was a floodgates just open. And I said, what is this? Like, I didn't understand how just moving location, but obviously what I was eating, I started eating more meat. I was drinking green tea anymore and all of these different things. And it just heavy. Back in Jamaica, the years rolled by and I was like, yo, you need to go and check up again. Because I remember they were saying 3 centimeters, they don't operate at 3 centimeters.
It depends on the location and the symptom, but generally speaking now, 3 centimeters, the average Jamaican woman, I would say 70% of women have some amount of asymptomatic fibroid, whether it be single or multiple, and it's usually around 3 centimeters or less, and they usually have no symptoms. You know, it's an incidental find. You do the ultrasound. Just last week I did an ultrasound. Lady just found out she was pregnant. We're doing the ultrasound and they said, oh, the baby's alive. I'm like, oh, there's a small fibroid. What? There's a fibroid there? I said, yeah, the baby is fine though, you know?
Oh my God.
you know, people just associate the fibroid with this whole negative, this negative picture.
And so, you know, when I eventually did my checkup, that's when I discovered more, and I came to you and we started, you know, our journey together. But let's just start by talking about what symptoms would you tell women never to ignore?
Okay. I mean, well, contrary to popular belief, as we said, fibroids your menstrual cycle is not supposed to affect your quality of life. Yes, you may have some mild cramping, but when it gets to the point where it's debilitating, it's heavy, it's getting longer. You're going from like 5 pads or 6 pads, which is still a lot, to maternity pads. You're passing clots. you become, what is happening, because you're losing so much blood, you become anemic, right? So I always tell patients, so the average blood count for a woman is about 12 to 13 grams per deciliter, and your diet is enough to replace that. When you see in your normal menstrual cycle, the average blood count for a male is about 14 to 16. We're not bleeding every month, but our diet, or a woman's diet, is enough to replace it and maintain it. So what is happening if you're bleeding so long and so heavy, that blood count is just going to keep on depleting, because the iron that you're supplementing your diet is not enough, because you're continuously bleeding.
Remember mine was 7.6. Crazy.
And it was pretty crazy, you know. So, and what happens when you become anemic? You get short of breath, the heart is racing, you feel weak, you know, you just don't feel like yourself. But the problem with anemia, and I think this is what happened to you, is that you're anemic for so long, is that your body compensates for it, right? So even though the blood count is low, your body kind of tells itself that, look, it's low, but we're going to work around it.
I was high functioning.
I mean, I told you, I don't know how you're in the gym working out.
Exactly.
This girl was in the gym working out with an HB of 7, very, very low.
The job though.
You know, and I was asking, you don't feel weak in the gym? You don't feel tired?
I did used to feel weak, but
how are you doing this?
I just used to like just work around it and just push. It's the will, you see. It's the will.
Yeah, the will. So those are the big warning signs. Heavy, painful, prolonged periods. Also, if you have, because the uterus is between the bladder and the rectum. Sometimes the uterus will press on the bladder, make you want to pass urine all the time. Difficulty passing stool, it's pressing on the back passage. Sometimes you can have back pain radiating to the thigh. You know, it's very, and sometimes the fibroids can, like when they're deprived of oxygen temporarily, they become or start to what we call degenerate or breakdown. So sometimes some women can have some sporadic bouts of severe pain. Pain.
Just outside of your period?
Just outside of your period. Just the fibroids are degenerating. They're very tender. You know, sometimes it may even warrant admission. You know, so it's just a debilitating thing. The playing field is definitely not level when it comes to men and women. You know, you know, it's a lot.
It is, and I think it's so very important for us to talk openly about it, and that's why I needed to do this episode, because I remember when I got my diagnosis, immediately you feel some sense of shame, and it's confusing because it's like, what's wrong with me? You know what I mean? And funnily enough, Doc, I remember I've told 2 people so far that I had surgery because I had fibroids, and they were like, you? I said, what do you mean? Of course. So there's still this idea that it only happens to a certain kind of person or a certain kind of woman.
And another thing is, you know, the unfortunate stigma that we have in Jamaica is that we're used to seeing these women with these large abdomens, you know. And it doesn't have to get that far for you to be symptomatic, you know. So there's a misconception when we see women who are, I'm sure you've heard of situations, oh, how far pregnant you are. You know, I hear it all the time in office. It's very embarrassing for the women as well, you know. Oh, yeah, how far pregnant, how much baby you have, you know. It's and that's a mentality that most of the average Jamaicans have, because we just think that, okay, when you have fibroids, your belly big, right? Generally speaking, and your period them heavy, or it's heavier than normal.
So let's talk a little bit about treatment. Firstly, can fibroids shrink on their own, or does you always require medical intervention?
No, man, they definitely can. All right, so fibroids, they can shrink on their own. But fibroids are driven by the hormones estrogen and progesterone, right? That women have floating around in their bodies all the time, right? So they have estrogen and progesterone receptors on the uterus, and the more estrogen, the more progesterone, the fibroids will grow and get bigger. So it's a good point I want to mention is that fibroids are only problems for women in their reproductive age groups. So what I mean, from menarche or from puberty up until menopause, that window, fibroids are not going to be a problem after menopause. They tend to naturally shrink, right? And they're not going to give any symptom, because the main problem with fibroids are heavy, painful periods. And the definition of menopause is no period for at least a year, right? So, and the hormones decrease and the fibroids can get smaller, and sometimes there are instances when women change their diet, fibroids can naturally get smaller as well. Just like, and the symptoms improve. Just like what happened to you.
Yes.
You know, when a friend of mine always told me this story. He had a set of twins who were his patients. Both of them had large fibroids and they are symptomatic of fibroids. One went the surgery route and one went the route of vegan. And the vegan, her fibroids almost completely disappeared.
Oh, really?
And the other one had her surgery and the fibroids came back, you know? So it's, definitely the diet has a big part. And I wouldn't say the playing field is level as well, because some people change their diet and they don't say any change. But, you know, it's like I said, it's multifaceted.
Yeah.
And we can't put a finger as to what will ease the situation or which woman will get more relief from doing X or from doing Y.
Because I have changed my diet. I am now pescatarian.
Oh, this is post-surgery?
Before, like when we met for the first time and we started going through the processes, I decided from then.
Okay, I didn't know that.
Yeah. So now I'm full blown.
Okay.
Full blown.
Excellent.
Yes.
Excellent.
One of the things too that we have to contend with is them coming back. Do they always come back?
They don't always come back. And there are some, I find in my experience, like women who have what we call advanced fibroid disease. The uterus is more than, for all intents and purposes, if you compare it to a pregnancy, more than 20 weeks or more than 5 months pregnant. I find those women have a higher incidence of fibroids, not only coming back, but coming back more aggressively. Right? So not everybody comes back, but just like we had that conversation, look, this thing can come back. The aim is to take out all the fibroids, which we did. But it can come back, and we're going to put some implementations in place to try and decrease the chances. But I do believe there are some women who have this fibroid gene, and it's more triggered easily than other women. So, and these are usually the women who have the advanced fibroid disease, and they're more likely for the fibroids to come back. Okay. You know, in these percentage of women.
All right. So let's talk about surgery. Now, I did a myomectomy, but that you don't always have to go that route. What are some other options for women? Okay,
so I always tell, there are really 5 ways, really. So one is expectant management. So what Jamaicans love to say, let me go and watch it.
And see.
There is a role for that sometimes. And I'm going to give examples. So for example, a lady comes for yearly checkup with her examination. The uterus feels a little bigger than what it should be. We did the ultrasound. There's some 3 centimeters fibroids, but she has no symptoms. And thank God for COVID, I can use this word or this terminology more freely, symptomatic versus asymptomatic. Because not all fibroids are symptomatic. And you can have women who have very large fibroids and have no symptoms at all, other than probably the notice the abdomen is a little bigger. Yes. It can also cause painful sex as well. As well, it can. Yes. So, first one is expectant management. Second one is medical management. So medical management, so we don't reach surgery yet, but we want to give you some medication to control the symptoms. So we can give you some anti-inflammatory to help with the pain, and it can also help to slow down the period. Sometimes if you're anemic, we can give you some iron tablets. There's hormonal therapy we can give. Some doctors will give the contraceptive pill. Just tell you to take the pill consecutively. And even if you don't take it consecutively, the pill will help to slow down the period and slow down the pain as well. There are other hormones like the GnRH leucine, right? Where we temporarily turn off the ovaries, because if the ovaries are off, that whole menstrual cycle, because it's brain, ovaries, uterus. So it's actually turned off from up here. It acts up here, and then if here is off, everything gonna be off, so you're not gonna bleed. So if you're not bleeding, you're going to have time to build up your iron count, right? Wow. So that's expectant, medical, surgical. Surgical is the myomectomy if you want to keep your uterus, hysterectomy if you have completed childbearing. The fourth one is minimal invasive procedures. One in Jamaica is called uterine artery embolization. That is where we block off the main blood supply to the uterus. So less blood, less hormones going to the uterus. It will shrink with time. There's some other ones in the States, Access and Sonata, will shoot energy to the fibroids to make it shrink. And the last one is dietary. You know, so like the green tea. A recent study showed that women who consume 800 milligrams of green tea per day and vitamin D, the fibroid volume and the fibroid symptoms would decrease up to as much as 30%, over 3 to 6 months. So I've been encouraging all my patients to take the green tea. Yeah, it helps. So that's my 5-prong approach when I'm talking to patients. I would just try to find which one is best for you.
Best, yeah. Just an aside, since when you put me on the Lucrin, to be honest, it's the clearest I'd felt in years. Like my mind, just sharp, clear.
Really?
Yes.
And
some people would say otherwise.
No, yeah, because temporarily it's turning off the ovaries, so it's a pseudomenopausal state.
Yes.
So I don't know if you heard about this brain fog of menopause. Some women complain about it, but I find that the Lucrin is not as aggressive as natural menopause. I haven't had any women who have had any severe side effects of it, but that's the first time I've heard that you had clarity. Yeah. Probably you weren't stressed out because of your bleeding.
I never had that before about at all, doc. Like I was so clear. I was just on the ball. I don't know, because with my period used to come with very intense PMS.
Yes.
So when with that out the window, I felt unstoppable.
Yeah.
You know what I mean? I was like, is this how men feel?
Yeah. Well, the contraceptive pill will help with the PMS symptoms, but once the ovaries are not working the way they're supposed to work, your symptoms definitely should improve. Yeah. So Lucrin, as Honika said, it's a injection. It lasts for 3 months, and as I said, it kind of shuts down the whole menstrual cycle. We normally use it, I personally use it if you're very anemic, to just stop your period, to give you some time to build up back your blood count. And also if the fibroids are very large, it can shrink the fibroids to something, it's just temporary shrinkage, but something that it can manipulate better during surgery. Sometimes you have some large fibroid, just want to get it down to something a little smaller so you can manipulate it in surgery.
Indeed. Wow. And I think too with the Lucrin, the reason why it was so good for me was because now I had more blood. Yeah. So I feel like that made me feel stronger.
No, not feel. It did make you feel stronger.
When we in the gym, I was just breathing.
More blood and oxygen going to the muscles, more to the brain. You're going to be functioning much better.
You see, and that is why you cannot sit at home when you feel weak or you're bleeding heavily, because the ripple effects, it's large and wide. You know what I mean? Wow. After surgery, healing after myomectomy, and women trying to conceive, what's the plan? What do you recommend for them?
Well, I'm going to answer that 2 parts. So I'm glad you brought it up because I'm going to segue to it. So fibroids can be associated with infertility, but a lot of women get pregnant with fibroids, like the example I gave you last week. So, but another stigma in Jamaica is that once you have fibroids, you're infertile. Right. But it depends on the location of the fibroid. I like to equate the uterus to a avocado pear. Yeah. Right? I don't know if I explained that.
You have. Okay. I wish you were taking your little uterus. It's interesting because I'm like, that's how small it is.
Yeah, I should have carried it. But so the uterus is like an avocado pear. It has 3 layers. You have the skin, you have the meat, which is the muscle, and you have the cavity. That's exactly how the uterus is. And fibroids can occur at any level. So it can occur in the skin, it can occur in the muscle, it can occur in the cavity. Sometimes it can come off the skin and branch off, and like the symptoms are just so much. But like sometimes if a fibroid at the back of the uterus is pressing on the rectum, it can give you constipation, it can give you painful intercourse as well. So the fibroids can occur anywhere. And like when it comes to the heavy bleeding, the ones in the cavity, right? The ones in the cavity tend to give you a lot of bleeding. So remember, that's where you're inside the uterus, the endometrium lining, where you actually bleed from. So you have a bigger surface area now because the fibroids are there and they're bleeding, and those ones can impact your fertility. Right. So those ones definitely you have to attend to. And also, if the fibroid is in the muscle, a lot of people don't know this. Probably didn't tell you this, but it's a muscle, and how the muscle controls bleeding at the end of the cycle is to contract.
Oh yeah, you did.
So if you have this big, normally if it's like this, it can contract effectively. But if you have this fibroid in here is not going to contract effectively.
Right.
So you're going to have prolonged bleeding. So your periods are going to get longer than what they normally are.
Yeah.
Right. So it can be associated with infertility. When it comes to recovery now, I mean, we normally say, I mean, you can attest it. I find most women, by 4 weeks, they're fine.
4 weeks, yeah.
You agree?
Yeah, I do. I agree.
Yeah, most women. And depending how you do the surgery, I'm doing some smaller incisions now. The smaller the incision, the less the pain, the quicker the recovery. We call it mini laparotomies for myomectomies. So by 4 weeks, you're fine, but we still encourage the 6 weeks. You know, by 6 weeks, the skin is fully healed.
Yeah.
I mean, the uterus takes about 3 to 6 months for the architecture to get back to normal. But in terms of you feeling yourself, by 6 weeks, it should be fine. And I encourage all the activities that you used to do prior.
To resume.
Right? And in terms of trying to get pregnant, we normally say wait at least 6 months before you try to conceive. And if you do conceive, unfortunately, you're going to have to get a C-section.
Right. Yes, you're gonna have to do a C-section for sure.
Yeah, because we have cut the cavity.
Yes.
And that's a weak point.
Yeah.
So when you go into labor, that cavity, just like you have a scar in the belly, you have a scar in the uterus, and it can potentially open up. We call uterine rupture. So we try, once you have a myomectomy and you get pregnant, it's just an automatic C-section.
Yeah. The good thing though, and tell me if I'm wrong about the C-sections that I've noticed, because I have friends who've done it, to me, and they've said it too, like they bounce back faster than a myomectomy.
I think it all boils down to your pre-surgery habitus.
Okay.
Just like I told you, I think surgery is surgery. It's the same. It's the same kind of incision, really. You know, where it's the same thing. Like, I mean, when I remember Dr. Samuels, one of my trainers, way back in the day, you know, he was saying, when I did my first myomectomy, he said, "Come on, Daley, you can take out a baby, you must can take out a fibroid." Right? You know,
gosh,
so it's instead of taking out one baby, you probably take out one fibroid. I mean, the most fibroids I've taken out is about 100.
That is crazy.
You know, so it varies, but you know, I don't think it's the bones. I think it really has to do with how your pre-surgical habitus was, and I find the women and the men who the surgery, once you're like active in the gym, you have a good diet, don't smoke, you're not drinking too much, and you're fairly active, your recovery is going to be much better.
Much better.
Much better.
What about those women who sit with the fibroids and the symptoms and just let it just go on and on without getting treated?
Unfortunately, it's a situation in Jamaica for a lot of women.
Yeah.
We say we like them love to watch.
Yes.
Yeah, man. They're going to watch it.
Watch
and
it eternally.
And when they come, they have advanced fibroid disease, and a lot of these women are desirous of myomectomies. I find, especially in 2025, I find women are delaying their childbearing. So what is happening? The average woman, you know, they're doing everything in their life. They're working, they're achieving all their academic and financial success. And when it's time for their children now, they're in their early 40s, right? So they have the fibroids and they want to conceive, right? Back in the day, a woman in her early 40s probably have 2-3 children already, and symptomatic of her fibroid, she just wants a hysterectomy. You know, but I find the majority of my fibroid surgeries personally are myomectomy, and my average age is like, I would say like 43, 44, right? That's the average age of my patient. But what is happening, women are just delaying and the fibroids getting bigger, and I mean, they need some kind of intervention, and you know, you have to shrink it down, get it to something that you can manage, and it's sad. Yeah. You know, and they're anemic, and it's really sad.
It's a lot. What I want to touch on is the public sector. Like, I know you also work there as well. So how can women who can't afford to go private, right, get help, get surgery?
I'm glad you brought that up. We have healthcare in Jamaica is free, as you know. It's been free since April 2008, if I'm not mistaken.
Yeah.
The system is overburdened, but we try our best. So the typical way, either you're referred to the health center by a private practitioner, or you're referred, not the health center, you're referred to the hospital by a private practitioner, or you're referred to the hospital by the health center, right? And then once you get into the health center, it's just a matter of stabilizing, just like what we did for you, but in a public setting, just trying to stabilize you and then getting you on the list, which can be like the waiting time at my hospital now, I would say is about 6 to 8 months.
6 to 8 months.
So if you come and you're ready for surgery, unless a space miraculously, a patient cancel and we can get it in, but if you come and you want surgery, it's about 6 to 8 months. Other places is like a year.
Yeah.
But we try at my hospital, at Maypin Hospital, we have a pretty quick turnaround. 6 to 8
that's very
bad,
good. Okay.
But we're still going to bring you back at increments, probably like every 2 to 3 months, just to make sure your symptoms not getting any worse or anything like that. But it's accessible in the public sector, and you have a lot of skilled surgeons in the public sector. That is where I learned to operate. So we get a lot of experience there. I did 2 today.
You did. Yeah. So, hey, that's what I love about it. When you say it and you just say, I just did 1 yesterday, I did 2 today, I did,
I did 1 on Sunday.
It's just second nature for you.
But this is what I do for a living.
Yes, what you do for a living.
This is what I was trained to do. So I'm going to do what I have to do.
Yes.
To you it may seem extraordinary, but to me it's me doing what I was destined to do.
But I'm happy that so, because we need great doctors. We need doctors that are passionate about what they do, and
I love what I do. To me the simplest thing is when a patient say, "Thank you, Dr. Daley.
Yes.
You changed my life." Like that does wonders for me. I don't need no gift. I don't need anything like that. That little sense of reassurance that I get. And I feel like I did some good, and that made my day. A patient told me that today. On my way home from work. 2 patients actually told me that today, and it, as I getting some goosebumps.
Listen, I'm getting teary here.
I'm getting goosebumps. To me, that was the highlight of my day.
Yeah,
that's the highlight of my day.
Wow.
As simple as, and it wasn't even a voice call. It was just a message,
Look at that.
Just a message.
Look at that. It's beautiful. All right, Doc. So listen, hey. It's time for me to feed you, right? So we've got Chef Bling in the building.
Big up Chef Bling.
Yeah. And Chef Bling is such an innovative chef. He's one who is passionate about what he does, right? And is always coming up with interesting recipes and different ways of, spinning old things that we're used to into new ways, of consuming them. So he's going to explain to us what he has in store for us today. Yeah.
Okay.
No, unfortunately, because I no longer consume meat, it's gonna be something pescatarian. Oh gosh. But yeah. Okay, Chef Bling. So what do we have here?
Yeah, man, Chef Bling. What is this now?
Alright, so this is jerk mackerel rundown sushi bites.
Okay.
So it's actually paying homage to, I don't know if you've ever been to Nobu. No, I heard of Nobu.
That's the restaurant?
Yeah.
Yeah, in Miami?
Yeah.
Yeah, man, I've been there.
Yeah, same thing. I've never been there.
Yeah.
Very, very high.
But I've heard of it. Rihanna is always coming out of Nobu. That's all. They always take picture of Rihanna coming out of Nobu.
I've been to Nobu.
Yeah, man. So you might know the head chef, executive chef, and part owner, Chef Nobu. Now his take on sushi was a crispy take, right? So that's where I got the base. So I made it into a canapé with an Asian, Jamaican kind of influence. The top, however, is jerk mackerel rundown.
Interesting.
Regular sushi base, crispy sushi base, and garnish with some black and white sesame seeds.
Nice.
Exciting.
Enjoy.
Thank you, Bling. Okay, got some napkins there, Doc. All right. This is always my favorite part, you see.
To taste?
Yeah, man. Anything we have to eat, I'm ready. But I told Chef Bling the other day, so I'm sure I'm gonna probably get fat,
Not for you. Cheers. Again. Your Chef Bling. I never know what I have. Sushi mackerel.
And I have some mitts in the honey pot here.
Yeah, man.
That I want us to get into. But of course, if you...
I thought there was some curry food in there.
And you know that is a.
So we see all of this. So we say some curry food.
It's meant to be honey.
It's meant to be honey. Okay.
But this is a Japanese pot as well. Like this is what we use, like especially during the winter time in Japan. You have that the fire in here.
This is from
Japan?
Japan?
I ordered it online.
Okay.
Right, but this is a kind of pot that we would use in winter time, especially like you put the fire in here and you're making the soup, and everybody sort of communally sharing from the pot. Yeah. Okay, let's see what we have in here. All right, so we did discuss this one. Fibroids mean you can't get pregnant, and we said that's not true.
That's a myth.
Yes, indeed. All right. Only older women get fibroids.
That's a myth.
Yes.
Far from.
Talk to me about like the age range. Like, how soon can fibroids appear in a woman?
Well, I mean, I would say the youngest I've seen it is probably like 21, 22. Symptomatic. Wait, I think she was younger than that now.
Yeah.
Yeah, she was younger than that. She was 19. And that was this year, actually.
Oh.
We actually thought it was a malignancy. Because there is something called so remember fibroids, the medical terminology of fibroids, what we call leiomyoma.
Yeah.
Right? And there's another one, the cancer one is leiomyosarcoma.
Oh.
So we had a young girl, and she was less than 20. She was 19. And this mass was growing so fast. We thought it was malignant, you know. But with all the testing we did, the MRIs, the blood tests, everything suggested that it was fibroid.
Yeah.
So we went in, and it was an interesting case. Young girl, that's the youngest I've seen, 19.
Yeah.
But the average age I'd say is about 20 to 21. You know, you don't really find teenagers getting fibroids. Because remember, as you're more exposed to more estrogen and progesterone, that is when the fibroids or the muscle or the uterus start to develop fibroids. You know, so I would say most women, if they do become symptomatic, they notice it in their late 20s to their early 30s. You know, and they tend to ignore it.
Yeah, man. Fully ignore. We have to stop it,
convince
guys.
yourself it's something else.
Exactly.
And you want to watch it.
Yeah.
But if you're bleeding down the place, if you're weak, if you're passing urine, difficulty passing stool, painful intercourse, if you see this mass in your belly, that's not normal. That's not normal. You need to get assessed.
Indeed. All right, let's see what we have here again. You should only see a gynecologist when something is wrong.
I love that. That's a big myth.
Yeah.
So I like that you brought that up. So most women come to the gynecologist. Sorry, don't forget the gynecologist, the doctor. When they're unwell, whatever the unwellness is, whatever it is, you know, abdominal pain, cough, cold, sneeze, fever, whatever. Most people come when they're unwell. We're trying to introduce a concept. Not trying to. I have quite a few patients who do it, but we're calling it the well woman visit.
Yes.
So you're well.
Yes.
And you're a woman and you're just coming for a visit, aka the checkup.
Yeah.
So at that time, you know, anything you want to talk about, we address STI screening, we address contraception, HPV, pap smears, anything. I always tell women that your gynecologist is one of the very few specialists you don't need a referral to go to.
Yeah.
We're the primary healthcare physicians for women. AKA we're the GP for women.
Yes.
You understand? Yes. I have many patients that I am their every doctor.
Yeah.
Like that. I mean, one come out to look in them here. I said, I said, ma'am, last time I owned an otoscope was many years ago. I don't even own one right now. But doctor, that's why I look at my ear. I said, I don't have that one. But you know, the well woman visit. So we encourage women, once you're sexually active or more than 21, you visit the gynecologist once a year. That is when we can pick up these problems.
Yes.
You come, we do the pelvic exam this year, next year I say, hey, Honika, you know your uterus feel a little bigger than it was last year. Let me do an ultrasound. You may not have any symptoms, and we're seeing some fibroids here, them small, let me just watch them.
Yes.
And we just assess you. So we can pick up stuff earlier. So prevention is always better than cure.
Indeed. Fully agreed there. All right, let's see. Ooh, so garlics can cure vaginal yeast infections.
Just put that one out. we're not entertaining that folklore. Not true.
Negative.
Not true.
Okay. All right. So do not put it inside of you. Stop. All right. Okay. All right. This one I think you're gonna like. Eating your placenta reduces postpartum, gives you more energy.
I just wrote that article.
Yes, you did.
Yeah. I know it's a patient asked me about it. She said she told me to write it. No, it doesn't. So there's no scientific evidence that suggests that eating the placenta helps with postpartum depression, helps with improving your blood count, any symptoms that you may have in the postpartum period. We like to practice evidence-based medicine where we know that this will definitely cause it.
Yes.
So, I mean, other than the fact that it may not be, when people hear placenta consumption, they're thinking about the raw placenta as it comes out, which some people do, right?
Yeah.
But when we hear placental consumption in 2025, we're talking about people getting the placenta, they're sterilizing it, they're purifying it, they're crushing it, and they're putting it into tablet form or slushies or whatever.
Slushies?
And, yeah, man.
Wow.
Or smoothies or anything.
Pretty intense stuff.
And they're saying that these placental tablets will help you to just improve your health overall.
Yeah.
There's nothing that proves that that is true. You know, I would definitely say that's a myth. A lot of the pro-placental consumption people may hate me for this.
Yeah, because I was just going to say.
They're going to hate me for this, but I'm just speaking from a medical perspective. That's all I'm saying right now, you know, so I wouldn't recommend it, you know. I mean, the placenta is during the pregnancy, it has a lot of growth factors. It helps to protect the baby, rich in it's like
rich in nutrients and all these things.
And in fact, these things called exosomes. Exosomes are stem cells that we get from the placenta.
Yeah.
They're we get it from, they're sterilized and they get them right before the baby come out or as the baby come out, and they're potent, you know. We get them, we freeze them, and we prepare them, and that has been beneficial. I'm not going to say there's no benefit to placenta, you know, but you have exosomes from placenta, you have exosomes from plants, you know, but the raw placenta and how them preparing the tablets and all of that right now, no evidence. Let me just say that safely.
No evidence.
No evidence.
Right, Doc. It's been an absolute pleasure. Before you go, what's one message you would like to send to Jamaican women about their health?
Just don't ignore the signs. If anything that seems abnormal to you, get checked out. But I want to ask you, how has your recovery been?
My recovery?
Yeah, we're talking about me. Let the people know how your recovery has been.
My recovery.
About the surgery, everything.
Yes. Oh my gosh. So, I felt really well taken care of. I had a lot of support, and that's one thing too that's very important. It's really good and really helps when your family or your partner or whatever can be there for you, because it makes it so much easier to deal with and to bear. If I had to do it on my own, it would be a different experience. And so I remember, I never forget this moment when I walked into the room, into the theater, you call it?
Yeah.
I was so happy.
You're happy?
I was so strangely happy that day. And I remember lying there, and so you know when you're about to do surgery, right? I've never done surgery before, so I think, okay, I need to stay as awake as long as I can, cause
that's not gonna work.
We'll see how long we can push this thing, yeah. And then when we just started putting the thing in my arm, and she was like, "You're gonna feel a little burn." I was like, "Okay." I was like, and I looked at the clock, 10:20, and I was like, I'm staying awake as long as I can. And then this other lady was like, "We're gonna put this over here," and I was like, "Okay, let's do this." Boom, nothing else, knock out, gone.
Yeah.
I vaguely remember, because I remember she was saying to me, that's the anesthesiologist, that I was going to wake up in a warm room because I would be very cold, and that she would be talking to me, but I wouldn't remember. I can't remember that.
Yeah,
but it's a kind of vague there, because I remember being in a different room, and I kind of remember moving to another room, but it's so vague, everything. But it really was a good experience, I can say. I remember waking up and just feeling really groggy and thinking that, so I remember she was saying that they would put a trach tube inside so that it helped me to breathe and everything. And I woke up, and then the nurses at Art of Surgery, amazing. Big up, thank you ladies so much. Them serious. It's time to get up. Yeah, man. You have to get up.
Man. I love it there. I love it there.
So I sit them up now and I say, okay, drink little tea. And by the time I start drinking little tea, I start feeling nauseous. And then I say, you have to walk. You need to start walking. Oh, listen.
It's called enhanced recovery. The quicker you get up, the more blood
and
flow,
moving.
the quicker you'll recover.
Yeah.
I intervene you now. How did it feel when you saw the pictures about the...
Crazy.
Yeah. I get the same response all the time.
Crazy, because when we see the pictures, I say, what? And then obviously, like, I'm lying there and you guys are doing the thing and you know, cutting out, so you're cutting out and all that. And I was like, wow. And because my brain is catching up because I was out, still, after the surgery, there are moments when I'd close my eyes and I would sort of feel... I mean, see, you're not really feeling it, so calm down. But the scenes, the video would play back in my mind.
Yeah, that's interesting.
You know
I've never heard that before. Yeah.
Yeah. My mind kind of extra. So that used to happen a little bit to me. But coming home was great. I had a lot of support at home. I was a little afraid of my staircase because I have a staircase, guys, coming up to my apartment. But because I was used to doing that staircase so often, it was fine. Because when I had some friends come visit me, they were like, "Oh, it feels really steep," and I was like, "Yeah," because I didn't really feel it because I was just used to it. And I felt good, and every day my tummy went down, the swelling went down more and more. And so what I used to do is once per week I try to just go on a short trip on the road to just like, you know, run an errand or something, just to follow someone to do that. And that was difficult, so I'd always take like a pillow with me. So nothing more than like a 2-minute drive. And I never forget the day, Doc. I remember the Friday, I went to pick up pizza. And the pillow on me, I said, boy, it's not as bad, but it's still look rough. And I kid you not, the Sunday, I went back on the road and I didn't feel anything. I was like, what? How? So that was pretty amazing. It's been an amazing journey and I'm so grateful.
I mean, so what is your plan moving forward now in terms of your whole female healthcare perspective since you've experienced this now? As a young female talking to the audience, what is your moving forward with your personal medical goals?
I'm on it like a bonnet. I'm doing my well woman checkups, right? And just holistically, like changing my diet, as I told you, just not allowing things to just run by. Because to be honest, I took a while before, because I came back from Japan 4 years ago. And I took all of that time before. Because I was sitting here in this couch talking to one of my friends. She's a nurse in England. And my period was near. And I was lying a certain way and I felt this mass. I said, what that? I'm saying to her, I say, you know, I feel this hard mass sometimes when my period is near. She said, really, you should check that out. And I think that was perhaps like the January, and it was not until like the April.
Yeah, it's when I saw April, when I saw May?
It was around May when I came to you. So what I have to say though is just don't wait around. When you feel it, you know something's not right.
100%.
And as Doc is saying, and I reiterate, heavy periods are not, supposed to be that heavy. It's not supposed to be that painful. I know, or even if you've had it all your life,
it's not normal.
It's not normal.
Don't normalize the abnormal.
Yes.
Don't normalize the abnormal.
Yeah. And if you have daughters, this to me too is one of the greatest charges. Like, because if our mothers were educated or knew about these things, then they would have taken us from early to check us out, to ensure we're all right. Take your daughters to get their checkups. If they're having heavy periods, don't just take them.
And I must commend you for getting your blood count up very fast, though.
Thank you. Thank you.
She did a great job. She went from 7 to 12 or 13. You went to.
I went to
It was more than 12, I think.
Yeah, man, it was high.
Yeah, man. And I remember when we got the result, and I said, Hanika, time to go in now.
Yeah.
I said, let's get in now before this period come back. And I mean, we moved fast.
Yeah.
We moved fast. I'm
happy we did that.
Yeah,
I'm happy we did that. See, you can do it too, all right? You can just check that out. Where can they find you?
All socials at Dr. Daryl Daley, OBGYN. Instagram, Facebook, LinkedIn. I'm on Twitter too, but it's Dr. D Daley, OBGYN. But everything else is Dr. Daryl Daley. Full name, DARYL, Daley, OBGYN. You can email me, ddaily@3dgyna.com. That's my personal email. You had any problem communicating with me?
Not at all.
Alright,
He's
I answer
very
every
responsive.
email.
I don't know
Every
how him do it. Okay.
Answer all email. I used to give up my phone number when I just started to every patient, and that was a disaster.
I can imagine.
So I find the emails when somebody emails, they really want some answers.
Yes.
I'll answer all emails.
Yes, sure. Well, thank you so much, Doc.
Thank you for having me. It was my pleasure. Thank you so much.
I've enjoyed this interaction immensely.
Yeah, man, thank you.
And you've changed my life.
I'm honored. I'm honored. Thank you so much.
Yes. All right, guys. Thank you so much for watching. If this helped you, then share it to someone. And don't forget to like and subscribe. Bye.
Bye.